A lot has changed in orthopedics over the years. Right now, the big thing is regenerative medicine, looking at cartilage restoration and taking somebody who's got an injury or a joint that's starting to go and rejuvenate that joint, allow them to continue being active much later in life without having to do joint replacements. That being said, joint replacements has also gone significant. They are lasting a lot longer. We see that, average knee replacements last in 20, 25 years, which is a lot longer than it was even 15 years ago. So patients were able to stay active. We're able to take younger people who we would have said, hey, look, you got to wait to get your joint replacement. We can do it now. We can keep you moving, keep you healthy, and I think that's the way to go. So the biggest thing I've seen change in orthopedics, really so much as in orthopedics, is people. People are being active a lot longer into their 70s and 80s. I've got patients in their 70s who run marathons. And so our job is to keep these people going, keep them moving. Two things happen. One, our tendons, our joints degenerate. Our tendons soften, they weaken. We're much likely to tear something, much likely to injure something. The other thing that happens is we get tight. Our tendons, our hamstrings, our quad tendons all get tight. We lose muscle mass, we get weaker, and all that increases the injury rate. So the key is helping people, one, stay flexible, two, stay strong. The injuries that we see in people in their 40s is different than the injuries we see people in their 70s. As we get older, we're much more likely to get injured. We talk about, in terms of less is more to some extent, but keep people moving. The more we move, the better. The difference between things that we see between athletes and the non-athletes, that line's actually getting a lot blurred over the years. We see athletes, especially in kids, they're becoming much more aggressive in terms of how they're training. They're training harder, they're getting stronger, they're faster. And then as we get into our 30s and 40s, a lot of the same injuries we'll see somebody on the weekend warrior is also the same injury as the guy who's doing construction. Same muscle groups, same type of activities. Our job is to keep these people moving, to get them healthy again and get them back either to work or back out in the playing field. In the knees, typically what we'll see is meniscal tears. They're very, very common. As we get older, that meniscus tissue weakens and it's much easier to tear it. We see that, in people in their 50s, skiing is a big one. Somebody will fall, have a twist, tear their meniscus. Another one is anterior cruciate ligament tears. That's very, very common. We see that in a lot of soccer players, skiers. We're doing more and more reconstructive surgery on people, and much later in life, people that we would have never reconstructed 20 years ago are saying, hey, look, I'm active, I want to stay active, and we're fixing them, doing their surgery, and they're doing great. Shoulder, a lot of things that we see is rotator cuff injuries, from tendinitis to partial tears to full tears. The rotator cuff is basically what keeps your shoulder moving. And so again, we're working on these folks. A lot of it's not surgery, a lot of it's rehab, sometimes injections. And the folks that need surgery, we're able to repair these folks a lot less invasive and get them back to playing tennis, back working. Folks are doing well. It really helps with people and their quality of life. It's a matter of twofold. One, a lot of folks are weekend athletes. They work really hard during the week, and then they get out and they play really hard during the weekend, sometimes too hard. And our job is to get them back safely, doing what they love to do. Same thing with folks who get injured at work. They come in, they need to go back to work, we get them healthy, and we get them back working. A lot of folks will let things go. They get an injury or something gets sore, it'll go away. They'll wait. 6, 8 months go by and they finally come in to see us. And a lot of times it would have been much easier to have taken care of that problem earlier. That being said, it's pretty common. Folks will come in and we can treat them. We always say it's a good idea to come in, and if it's nothing too bad, great. We can kind of fix whatever the ailment is before it gets worse. So we always recommend folks, not putting stuff off. I have a 16-year-old female rugby player, tore her ACL. She basically came in, we evaluated her, MRI scan, diagnosed her tear. She had reconstructive surgery. She's currently, healing and rehab. We expect to be able to get her back on the rugby field within 3 or 4 months. 40-year-old gentleman, construction worker, tears his rotator cuff, comes in, workman's comp injury. I can't work, I can't lift, it's killing me. We'll go ahead and diagnose it, MRI scan, and reconstruct his rotator cuff, and within 3 months, he's back working. Rotator cuff tears are interesting. The rotator cuff is what controls the shoulder. The rotator cuff attaches to the bone, and many times it tears off the bone. As a result, the mechanics of the shoulder get altered, and patients come in. Typically, they have pain and weakness. Diagnosis is typically done by MRI scan. Surgery is done arthroscopically, meaning it's all done inside the shoulder, and what we do is repair that tendon back down into the bone. Takes a little while to heal. There's a biology that has to occur. They're typically immobilized for about a month after the surgery, and then a rehab program starts, and that usually goes on for a couple of months. About 85–90% of people with rotator cuff tears do very well. Typical knee injuries that we'll see, one is meniscal tear. In an adult, typically the tear, what'll happen is the meniscus will tear. It creates a flap of tissue that rubs inside the knee. It causes irritation, sometimes even mechanical symptoms such as locking and giving way. We'll go in arthroscopically in an adult, and we'll trim out the torn piece. Sometimes we'll repair it, sew it back together again, get that meniscus to heal so this tissue doesn't rub. Anterior cruciate ligament injuries, very common. We see it a lot in young athletes. The ACL is a stabilizing ligament in the knee. That'll get torn. If left untreated, the knee is unstable, so we will go ahead and reconstruct it. We'll go ahead and recreate a new ligament for them. It does really well. 90% of folks do great. They heal well. We rehab them, get them back on the playing field. One of the nice things about the Orthopedic Institute of New Jersey is we have specialists that takes care of every body part. As a shoulder and knee reconstructive surgeon, folks will come see me as a specialist in the shoulder and knee. But interestingly enough, somebody may come in with shoulder pain, but it's really their cervical spine that's causing their problem, not their shoulder. We'll go ahead and see them, diagnose it, and say, hey, look, we're going to have you go see my partner who's a spine specialist, and he's going to take excellent care of you. So we can really take care of the body soup to nuts, head to toe. We not only do reconstructive surgery, but regenerative medicine and non-operative treatment. A lot of folks don't need surgery. They can come in, we can diagnose, sometimes injections, medication, therapy, and we can get them back to doing what they want to do. Interestingly enough, looking at the different injuries that men and women can have, women have a tendency to have more knee problems. Specifically, women are much more higher risk at tearing their anterior cruciate ligament than men are. Statistically speaking, if we have a group of female athletes, group of male athletes, more of those female athletes will tear their anterior cruciate ligament. There's been a lot of work done on preemptive rehab for these folks to teach them how to perform on the court, on the field, to prevent these injuries. And that is changing in terms of the number of these injuries that we see. We get tight as we get older. Our ligaments, our tendons all tighten up. And stretching is a huge preventative medicine type thing. Folks don't stretch. Even weekend warriors will go out and just, all right, let me go play basketball, and they'll just hop out of their car and go start playing. There's no warm up, there's no stretch. And that's really important. Loosen the muscles up, get them warmed up, get them working at peak capacity before you start doing something. And the other is strength. We all lose strength as we get older. Our muscle mass decreases and our muscles are just less resilient. And so, in terms of working out, we like to say, you should be doing 3 days a week of aerobic type exercise and 2 days a week of strength training. On a personal note, I tore my meniscus several years ago skiing. Caught a tip, wiped out, kind of got up and said, oh, my knee kind of feels funny. As with most people, I continued to ski that day. That night, my knee just swelled up and I went, oh, that's not so good. MRI scan, had a tear in the meniscus. Tried rehabbing a little bit, started really getting mechanical symptoms in the knee, mechanical locking, and subsequently had arthroscopic surgery. Post-surgery, I went back to work 3 or 4 days later, started riding my bike 3 weeks later, started running about 2 months later, and knock on wood, I'm doing great. I'm a big exercise fanatic. I think it's important. So my poor wife, I drag out. We go bike riding, walking. Both my kids, I have 2 boys, 24 and 20, and they're very active. They play soccer, tennis, both work out, pretty much daily. Unfortunately, they're both now much faster and stronger than I am. So, but yeah, it's part of my life, and I try to impart that on my patients also. I think one of the big things with orthopedics is going to be cartilage restoration in terms of being able to take a patient who's got an injury to their knee or shoulder where they've got cartilage damage and being able to restore that cartilage. Right now, that's a huge topic, tons of research going on in there. And I think we're going to be able to take an individual who has an injury and be able to salvage their knee or shoulder without subsequently having to do joint replacement surgery. And I think that's really where the big kick's going to go.